Hey guys, welcome back to my YouTube channel. So guys, if you've not subscribed, kindly subscribe. Returning subscriber, thank you very much for always clicking in. Like the video, share, comment. Don't forget to turn your notification bell so that every time I post a video you will be the first person to be notified. So guys, I want to talk about some of the symptoms, pregnancy symptoms that might present before missed period. Yeah, some of the pregnancy symptoms or signs and symptoms that usually present before missed period. So before that, we know that everyone experiences different symptoms of pregnancy and at different times. It is important not to compare your pregnancy to someone else because pregnancy symptoms can vary and can be so dramatically according to each and every person. There are several symptoms of pregnancy that you may experience and you might have, and the most signs usually start about immediately after you are after you've missed period, and they will become worse from 8 weeks, 8 to 16 weeks, 8 to 12 weeks. So as we know that a missed period and is the common sign and obvious signs of pregnancy. So once conception has happened, your body produces hormones that stop ovulation and the bleeding from the lining of the uterus. This means that your menstrual cycles have stopped and you won't have period again until after your baby born or after your baby is born. But missing your period is not always a sign of pregnancy. So you can also miss your period from stress, exercise, diet, imbalance hormone, and other factors that might cause irregular missed period. So the first sign that will happen even before that missed period is frequent trip to the bathroom. Before you even miss your period, you may notice that you have to pee more often. This happens because you have more blood you have more blood than before, and during pregnancy your body supplies blood increase. So your kidney filter your blood and remove extra waste. This waste leave your body as you urinate. So the more blood in your body, the more you have to pee. So I will say, if you don't have experienced this, a sign is also another sign that you are having anemia in pregnancy. Another sign is fatigue or feeling tired. Many people feel extreme tired in early pregnancy. These signs of pregnancy happen because of high level of the hormone progesterone. Similar to other early pregnancy symptoms, fatigue tends to get better in the second trimester. So however, it does come back in the third trimester for many people. So you will experience it from the first trimester after immediately you miss your period, and it will come back in the third trimester for some periods. For some people, not some periods, for some people. So we also have morning sickness. Despite the name, this pregnancy symptom can happen at any time of the day or night. Nausea can happen as early as 2 weeks into a pregnancy. Not everyone experiences nausea, and there are various levels of nausea. So you can feel nausea but never vomit. About a half of pregnant people vomit due to nausea. Though nausea during pregnancy is fairly normal, it can be a problem if you become dehydrated. People who cannot keep down food and fluid because of extreme nausea could have a condition called hyperemesis gravidarum. So contact your healthcare provider to correct dehydration, because with vomiting you will experience dehydration. Another sign is breast tenderness or swelling of breast. Your breast can become tender to the touch during pregnancy. The soreness may be similar to the way your breast feel before a period. Only, so your areola might also begin to darken and enlarge. This soreness is temporary and fade once your body gets used to increase of the hormone. You may also notice your breasts have gotten larger and your bra is more tighter than normal. Remember, the only way to know that for sure that you're pregnant is to take a pregnancy test or have healthcare provider perform an ultrasound. So we also have other signs that I'm going to talk about, like spotting, which also called implantation bleeding. Although it may seem like a bad sign, light bleeding or spotting can be a sign that an embryo has implanted into the lining of the uterus. So implantation takes place about 10 days after conception. That means you will experience this before even the missed period. So implantation bleeding look like small drop of blood or brownish discharge from your vagina. It can start around the time of your regular period and can last for a few days to a week. Spotting can cause some people to think they have just had a light spot, a light period, they are not pregnant. Another one is for craving for food and constant hunger and food aversion. So food can be complicated during early pregnancy. Some people begin to crave certain food or feel constantly angry immediately they get pregnant, while some food and flavor may seem wonderful in early pregnancy. Others might suddenly taste unpleasant. Food aversion can happen throughout pregnancy, making you dislike things you previously enjoyed. We also have metallic taste in your mouth. Many people say that they experience metallic taste in their mouth during the early stages of pregnancy. It may taste like you have a pile of coin in your mouth. This can happen when you eat certain food or randomly throughout the day. Headache and dizziness is one of another early signs. Headache and the feeling of lightheadedness and dizziness are common during early pregnancy. This happens because of both the hormone changes in your body and your increasing of blood volume. Cramping is another sign. You can also experience mild period like cramp that come and go a few days. If these cramps are felt mainly on one side of your body or severe, it is important to contact your healthcare provider immediately. This could be a sign of an ectopic pregnancy or other complications. Mood swing. As your hormone continue to change, you could experience mood swing. This is normal and can happen throughout pregnancy. However, if you ever feel anxious, depressed, or have thoughts of harming yourself, it is important to reach out for condition. Some people experience fatigueness in early pregnancy due to the increased hormone levels in blood. So the mucous membrane in your nose become dry and more likely to bleed. We also have bloating. While it may take several weeks or months to have noticed baby bump, the surge of hormone can cause your stomach to feel bloated and lead to pass gas more often. Acne and skin changes. Your increased hormone and blood volume are to blame for any skin changes you experience. While some people get pregnancy glow and clear skin during pregnancy, others may get more pimples. Something that I want to talk about is when can someone take pregnancy test, because we are talking about signs and symptoms before this period. So we have several signs that will come in when as pregnancy goes. Or as you continue in the trimester, you will experience more signs, not only the one that I've said, but some of them can continue even to the second and third trimester, or after even you notice there is missed period. So pregnancy tests work by detecting a certain level of human chronic gonadotropin hormone in your urine. So you can take pregnancy test as soon as you missed your period. However, it is best to wait at least 1 week after you have missed your period to get the most accurate result. So while some tests claim to give you accurate results before missed period, taking a test too soon can result in a false negative. Your healthcare provider can take blood tests to test for pregnancy as early as 1 week before a missed period. So another thing that I know is that pregnancy test should be taken after 2 weeks of intercourse. After 2 weeks of intercourse, you can take pregnancy test. But remember, it can give you also false negative result because the human HCG hormone is not still in your urine. So immediately after missed period, I will advise you immediately after missed period, maybe after 1 week is when you can take pregnancy test. So anything you want me to add, you can write in the comment section. Anything, any medical explanation you want, you can write in the comment section. I will always consider. See you next time.